Okay, so welcome everyone to the 3H's Initiative webinar, which is Housing, Handling and Habituation of Laboratory Rodents, developed by Professor Emma Robinson and her team here at the University of Bristol. We've got over 1,500 people registered for this event, which is absolutely fantastic and points to the obvious interest there is in improving animal welfare for lab species. So I'm Jess Eddy, I'm one of the NC3R's programme managers, and I'm firstly going to cover some housekeeping points. So as you can see, this is a hybrid event, and NC3Rs are supporting the online aspect through their Zoom webinar account. The registration list and event recording will be shared with Emma's team. Those of you online will see the Q&A function. Please do post any questions you have throughout the webinar, but just to note that there won't be a live Q&A at the end due to the number of people that have registered. Those questions that you post in the Q&A won't be seen by the other attendees. And after the webinar, a log of all attendee questions will be sent to Emma and her team to answer at a later date. Alternatively, you can send your queries directly to the 3H's Initiative email address, which can be found on the 3H's Initiative website. So without further delay, let me introduce you to Professor Emma Robinson. Emma is a professor of psychopharmacology based in the School of Physiology, Pharmacology and Neuroscience here at the University of Bristol, and she was the previous AWERB chair. Her primary research focus is studying neuropsychological mechanisms implicated in the cause and treatment of mood disorders. And as part of this work, her group has developed objective methods to quantify effective state changes in rodents, which now supports a research theme in animal welfare. Her NC3R's funded projects include investigating whether male mice might prefer to live on their own, and whether ultrasonic vocalizations could provide the elusive, graded measure of affected state needed to inform refinements for the laboratory rat. Welcome, Emma.
Thank you very much, Jess, and thank you very much to NC3Rs for your help in bringing together this launch event. And it's just amazing to see so many people interested, and it gives me a lot of enthusiasm for taking this initiative forward. So what I just wanted to do is just give you a little bit of background to what we're going to be doing over the webinar. So I'm going to tell you a little bit about the 3H's Initiative, so how it came about, a little bit more about our work, the framework and our ambitions, and the methods that we use to evaluate the welfare impact. So it's a fairly brief sort of summary, really. But anybody interested in finding out more, please do get in touch with us. And then we're going to talk, we'll have two additional speakers. So applying the 3H's to the management of laboratory mice from Megan Jackson, and then applying the 3H's to the management of laboratory rats with examples from Julia Bartlett. So just to give you a bit of my background, so I actually started my experience with animal research in 1995 as an undergraduate student here in Bristol, where I studied alcohol withdrawal syndrome in mice. And in 1995, the norm was you kept sort of, you know, a dozen to a couple of dozen little TO mice in a cage with sawdust, and that was it. And that was just the norm. That's just how we kept laboratory mice. And no one really questioned it. And despite having actually grown up with large numbers of rodents as pets and been interested in rodents all through my childhood, I didn't question it either. It was just how we did things. And I really feel like I've seen so many changes and been part of, to some extent, those changes. And what we're trying to do here is take it to a whole kind of new level. And that's partly been linked to our own research and our interest in mood disorders, which I'll come to in a moment. So in 1999, I moved onto a PhD and began exploring the mechanisms underlying antidepressants, became quite frustrated by the animal models and wasn't really that sure I wanted a research career. So I went off and became a temporary lecturer with very little research, and then changed my mind and decided, no, I did want to do research, came back with, luckily, an award of a fellowship. And what was really important for me at that moment was it gave me an opportunity for change. When you set up your own lab, you stop working for other PIs, you stop being involved in their way of doing it. You can start again. And what was even better is that actually that independence meant that I could set up how I wanted to manage my animals. And also I was setting up completely new models. So I wasn't having to compare to the past literature. I didn't have to have replication. I was doing something completely new. And so I think I was lucky, but also that was where this opportunity came from. And what we've been working on is establishing novel translational methods for depression research. And it's led us to question lots of things. Are normal laboratory rats and mice really normal? No. In fact, the chronic mild stress that we see in their housing, their handling, their fear of humans probably makes them a pretty good model of depression. And you start to question, you start to think about these things, and you realise that actually there is widespread use of handling methods, physical restraint, scruffing, that actually these animals find really aversive. And so we started to question, partly from a welfare point of view, but actually predominantly from a scientific point of view. I'm interested in emotional changes in affective state. And I cannot see that, I can't quantify that, and I can't use that for my scientific research if these animals are in a poor affective state or a very labile, so it's changing all the time, because it's impossible for us to do the work that we do. So that's kind of the background. So the challenge, as far as I could see, to managing laboratory animals was that there's always been a fantastic literature around sort of welfare science, but we have to be able to manage animals for routine health checks, for husbandry, to do regulated procedures. That's the scientific objectives. That's what they're here for. And there are space limitations and cost issues in our animal facilities. It's not practical to use large enriched cages. I mean, we've done it. The rats run from top to bottom. It takes half an hour to catch them. They get a sense of humour about it. You know, we know these things are difficult. We need to be able to manage large stocks, but often small units. We might have hundreds of animals, but they're in little cohorts. They're breeding stocks of certain GA lines. How do we then achieve giving them a more natural environment? We need easy access to individuals for health checks, for regulated procedures. Environments required to be controlled, compatible with scientific objectives. And we have to work within the Home Office guidelines. And if we think about this from the point of view of cumulative suffering, and I do think that we've tended to focus our ideas around refinement very much around procedures. But the harm benefit encompasses, you know, the whole of the animal experience. It's not just about the regulated procedures that we do, and that tends to be what the Home Office licensing focuses on. We talk very much about the procedures and their, you know, what's the sort of pain, suffering, lasting harm that the animal might experience. But we don't really necessarily think that much about their husbandry and the non-regulated interventions. But these actually contribute to the lifetime experience of the animal and provide potential opportunity for refinement. Put simply, if an animal doesn't like interacting with a human, every time it interacts with a human, it's a negative affective experience, and those accumulate. If an animal likes interacting with a human, it has a positive affective experience, then those positive affective experiences accumulate. So we can think about it much more in that kind of framework. So what are the key factors that we've sort of identified that contribute to cumulative suffering? Well, laboratory caging systems and management methods. We know that small cages restrict natural behaviours. Something I've got really interested in is also the limited opportunities for sensory enrichment. Because actually, rodents particularly love sensory enrichment. They live in a sensory world, and yet we keep them in environments which nothing changes. We use the same sawdust, the same bedding, the same cardboard. That's it. That's all they experience from birth to death. That's it. Whereas actually, we could be much more imaginative with the types of sensory enrichment we provide. We also induce frequent social stressors. We do need to do that. When you keep animals the way we do, we've got to manage their hygiene. We need to be able to clean cages out on a regular basis. But that is a social stress for rats and mice, particularly mice, who, when you change all of their environmental cues, it can trigger fighting. We all know that mice are more prone to these interactions after cage cleaning. So we've got these stressors. We also repeatedly use physical restraint. We do this as part of routine husbandry when we're wanting to health check animals, but also for common procedures, substance administration. So physical restraint is just an accepted norm. And up until quite recently, it was an accepted norm for me as well. I remember doing restrained dosing in rats, chronic IP injections, chronic oral gavage within a few days. They hate me. I don't particularly like doing this. It's very stressful for them. It's stressful for me. Is there a better way? Is there a way of avoiding that physical restraint? Well, nobody when I was doing my PhD or early in my research career would ever question you have to physically restrain them. And also just the negative associations that form with animals and humans. I have had quite a lot of pet rats in my time, and my pet rats really like me. They used to approach the cage. They come to their names. You can train them. I would say they're not far off being like a dog as a pet. You can do a lot with them. So why do the lab animals go to the back of the cage when you approach them? Because they have this negative association. Of course, rodents have a natural fear of humans, and then that accumulates. So the more experiences that they have that are negative rather than positive, then that perpetuates that fear. And they have aversive experiences. We can't help it. Part of what we do, we sometimes have to transport them. We have to sometimes do procedures. It's not that we're saying you shouldn't be doing those. It's just that they are going to have an impact, and we have to think about how to mitigate that. And so I think there's two very simple strategies that we can adopt, that everyone can adopt, that are really got the potential to have big benefits to animal welfare, but without compromising scientific needs. If we adopt methods which reduce the use of physical restraint, we will reduce the aversion associated with human handling. And therefore, we can actually turn negative experiences into positive experiences. And in fact, we can do this across the board. We can provide positive, effective experiences with one very simple thing, and that is that rodents like rewards, like we all do. They like sweet treats. They like rewards. They can form very quickly. Pavlov's taught us animals very quickly will anticipate reward. And the anticipation of reward is a positive, affective experience. And so by simply, even if you do nothing else, if we just had everybody, when you do cage checks, when you do cage cleaning, just sprinkled a little bit of reward into the cage after every experience, then rather than the door opening and the rats going, oh no, who's coming in to do what? The rats will all be at the front of the cages saying, hey, are we going to get something for this? So you're getting positive rather than negative. But we've expanded that a bit more, and we put together the 3H's initiative, which is all about thinking about these three different aspects. So housing, handling, and habituation. So this is the kind of framework concept. So our aim is to focus on the lifetime experience of laboratory mice and rats and methods which will improve their positive affective experiences and reduce cumulative suffering. So we're not focusing on specific procedures, specific interventions. This is much more of a general framework, thinking about how we interact with our animals on a day-to-day basis. Our core aims, we want to reduce the use of physical restraint, which causes distress. We all know that. We've all experienced working with animals and seeing that. It will induce a negative affective state, and that has long-term detrimental effects on the animal's welfare and also impacts on science. We want to consider how we can improve the housing of laboratory rodents by providing more natural environments, but whilst also acknowledging the practical requirements of scientific studies. There are always going to have to be compromises. So how can we provide animals with more opportunities to express natural behaviours whilst also enabling us to manage these animals to still do what we need to do? To develop habituation methods that will facilitate a more positive, effective association with the handler. And this can help to then mitigate the negative impacts when we do have to do aversive procedures. And I think really critical to this, and where I think we have been able to, we're quite unique here in Bristol, and that is that we've developed these objective methods that enable us to quantify in an unbiased way. We're not anthropomorphizing, we're just using an objective readout, either our affective bias test, reward learning assay, or judgment bias task. These are tasks which will tell us about the affective state change that animal experiences. We have two main readouts that we use. We can look at core affective state by looking at reward learning, and this is a sort of cognitive biomarker that comes from human research. So people with depression have impaired reward processing. Rats in depression-like states have impaired reward processing. We can now we validated it. We can now use this as a way of looking at the effects of novel interventions. And our affective bias test, which allows us to look at a much more dynamic type of emotional change. So this is where we can ask the question, what was the emotional state when you experienced X versus Y? So we can really tap into those short-term changes in affective state as well. And if anyone's interested to know more about those methodologies, we will get the website updated with a bit more in the future, but do get in touch with us. So why is there a need for refinement to methods requiring physical restraint? Well, physical restraint causes distress. It's used in almost all methods of substance administration in rats and mice. In mice, it nearly always involves aversive tail handling methods. And repeated experience of physical restraint can impact on the animal's lifetime experience. So repeated physical restraint is a model of depression. It's been used as a model of depression for decades, actually. Okay, the physical restraint period is longer, but actually it is just once daily physical restraint for 2 weeks and you get a depression-like phenotype. So it's really important. And, as this is part of just normal day-to-day, do you want your normal control to actually be in a depression-like state? We wouldn't allow studies in humans that were depressed to be normal controls. And so perhaps we should think about the scientific implications of that. So what we've learned from studying depression-related behaviours in our rodents is that I think we definitely underestimate the impact of physical restraint within our protocols. Acute or repeated physical restraint has effects on control data variability, and reproducibility. And one of the really interesting things is that animals really vary in how they cope with physical restraint. And so some animals will develop these active coping strategies. They will vocalise, they will struggle, they will rebel against the handling. Others develop passive coping strategies, but they are both actually associated with negative affective states. It's a well-known part of depression research is that if you expose animals to inescapable stressors repeatedly, then they develop learned helplessness, passive coping. And that's actually thought in some ways to be a more negative affective state than those that are still sort of responding with some struggling. So stress in lab animals, and there's lots of literature on this, we know it affects the severity of the disease model, response to pharmacological treatments, both morbidity and mortality. So stress matters for science and animal welfare. And these are just a couple of examples. This is a kind of classic restraint stress quantification of corticosterone and the stress hormones. So acute restraint stress here induces an increase in stress hormones over the period. So this is the period of restraint. At the end of the restraint, it then starts to decline and recover. And then this is our affective bias test data. So here what you're looking at is the affective state induced by the treatment. And you've got a number of different drugs. So these are drugs that are associated with induction of depression in humans. So these are two clinically, these drugs have both been in the clinic. This one was withdrawn due to inducing negative affective symptoms in about 40% of patients. This drug is still used, but with a black label warning that it causes depression. This is a drug which FG7142, this is a benzodiazepine inverse agonist, which interestingly was given to people. It was thought to be a neutral antagonist given to people. They had panic attacks. So it induces quite a profound negative affective state. And then I wanted to just highlight that stress is about as potent as that. So you might think, oh my goodness, that must have been a really long stress period. This is 10 minutes restraint stress, that's all. So the animals had 10 minutes restraint stress, and we're asking it, what was your affective experience of this relative to just being in your home cage doing nothing? And that is the level of sort of negative effect we see. And I think it's quite interesting because we don't think about physical restraint as having any particular procedural impact. But if I was to say to you, I wanted to inject LPS or interferon alpha, I was going to induce an inflammatory response, then they would certainly be regulated procedures. And if you give LPS to an animal, you make them feel a bit sick and they look a bit sickly. Well, it doesn't induce as profound a negative affective experience as the acute restraint stress. So it kind of gives you some context to what 10 minutes restraint looks like. And also, I mean, I was really surprised by this. This was not what I was expecting to see. We were doing these because we wanted a sort of psychosocial manipulation to compare it to the pharmacology. I was never expecting it to be as potent an effect. And interestingly, this idea of animals acclimatizing to it, or many people call it habituation, well, it doesn't, because what happens is if you repeatedly give them one exposure a week, it amplifies over time. So they're actually getting a more negative association with that experience rather than showing any attenuation. So we use a variety of objective methods, and people have used a variety of objective methods to quantify affective states in non-human animals. Commonly, you see things reported like plasma, salivary, fecal corticosterone, fecal pellets, overt signs of distress, grimace scales, and score sheets. But I think where it comes to thinking about the animal's affective experience, the emotional component of it, it's much harder because they're not going to show outward clinical signs. People with depression don't show outward clinical signs largely. Even with anxiety, you don't actually, it's not obvious. And so unfortunately, many of these scales and many of these methods are much more geared towards a more severe acute experience. So classically, if you've given a drug that's caused a adverse side effects, or animals post-surgery wanting to look for pain indicators, where these measures are great. But for the types of interest we have in the kind of welfare, the long-term welfare costs, they probably do lack sensitivity. And I think there is also this potential for interpretation biases, and we have our a priori biases, and that I think has influenced this field. Whereas our objective measures are based on a neuropsychological model of affective state that's translational, so it works for humans down through even some suggestion of being able to pick up something like this in honeybees. So people have even looked at these biases existing in bees. So we have our affective bias test and our reward learning assay, and I'll show you a little bit of data that we've obtained. Just to, I'm going to leave the others to talk about the specific methods, but I just want to highlight some of the publications that we have, but also how we've used these methods to really try to quantify the welfare impacts of what we've been doing. So you're going to hear about refined methods for substance administration. I've taken the video out to leave that to Julia to show you the methodology. But we have this way in which we've refined. So we're not using a traditional scruffing method to restrain our rats. And we can look at classic kind of measures, these overt signs of distress, so struggling scores, vocalization scores. And what you're looking at, if you just concentrate on this first set, so you've got the standard method and then our modified method. And we've done this in Lister-Hooded's, Wistar's, Stock. One of my favourite challenges was when our animal technician team here challenged me to use an IP injection in the relatively unhandled stud male Wistars, because I think they thought I was going to lose my fingers and they were going to be amused by my method not being quite as bomb-proof. Well, I can tell you it was. And yes, you have to be a little more careful as you start to pick them up because they are a little bit unsure about this. But the method works in unhandled, unhabituated. If you know what you're doing, I wouldn't suggest starting off with that. But you can see overall less struggling scores. This is massively different. Vocalizations almost non-existent, and fecal pellets almost non-existent. And I mentioned about fecal pellets in the last slide, and actually I always it's never been the most reliable method because most animals, when you handle them, produce fecal pellets. Well, that's not true. So what you'll find, and I hope those of you who visit our animals will see, is that our animals don't produce fecal pellets or urinate. So if they're used to being handled and they associate you in a positive way, this just doesn't happen. So actually fecal pellets are brilliant. So I've changed my mind, and I think they are a really good way of thinking about whether or not your animals have a positive association with you. And you can see here that fecal pellets are almost non-existent. And this has a really good advantage for any of you thinking it's this time consuming, because actually it means you don't have as much clearing up to do after you've done a dosing study, because you won't have fecal pellets on the floor. But importantly, it's also other objective ways of looking at this. So corticosteroid is actually reduced by 50%. Because I'm a pharmacologist, we also looked at plasma levels of the drug. No, there's no difference. I didn't expect there to be any difference, but our method doesn't. So you can use these controls. You can look for things that are important for your science to say, no, these aren't being changed. But most importantly, this graph here, this is our objective assessment. So what happened here is the animals were scruffed, IP injected, versus our modified method, IP injected. It was seconds of a scruff. It's not a 10-minute restraint. This is just seconds of a scruff. and they show a negative affective bias towards that experience. So we can actually detect and quantify with a reasonable overall mean. Yes, it's smaller than 10 minutes restraint, but it's still a significant quantifiable negative affective state associated with restrained scruff injection versus injection. So it just really shows how much of a difference that physical restraint is making. The needle's still going in the animal, the drug's still being injected. We've also been really interested in the stories around tickling and the idea that we can use tickling as part of habituation. And this was a paper we published a few years ago where we used our affective bias test to ask the question, is tickling associated with a positive affective experience? And the great news is, yes, it is. So, but what's really interesting is that there is a grade. So this is their affective bias. So this is a positive. So they are more positive about experiences when they've been tickled. And that is a way in which we can say, yes, they were in a more positive affective state. But the fun bit comes when you do a correlation with this. Because what this showed us was that there was a beautiful correlation. So the guys down here who didn't show a positive affective bias are also the guys down here that really didn't vocalize very much. So not all rats do like to be tickled. However, the guys up here that are giving out these very high numbers of calls are also the ones that have the most positive affective experience. And it's led us on to a new project, which is looking at whether or not actually these 50 kilohertz vocalizations could be in rats, a really simple way of finding out how much fun they're having and how those interactions with you translate into an affective experience. So, our affective bias tests and those methods are really brilliant, but they are limited. Only certain people can do them, and they're quite time consuming. So if this works, it'd be really brilliant. And we have used it. We've used it in one really simple way, which is if we record the vocalizations of rats being exposed to the ball pit and the playpen, which again, you'll see videos of the way we do this. What you see is that these animals are giving out lots of these high frequency positive calls. And what's great is they don't really habituate. They don't get used to it and get bored and stop calling. They're still calling away, and they don't seem to mind ball pits or playpens. They're quite happy with either. And then we also have been able to look at this playpen intervention to ask another really important question, and that is, can you mitigate the harms, the affective harms associated with an intervention by giving them access to something positive? So for our work, actually, I'm interested in negative affective biases, so I wouldn't necessarily want to do this. But if I wasn't interested in changing the affective state of the animal, then what you can do is, this is animals been given that dose of FG7142. It gives it an anxiogenic experience. It's a negative affective experience. If after they've been injected with the drug, rather than just going back into the home cage, later we put them in the playpen, then you can see that we've attenuated. So although they still have this negative affective experience, by giving them playpen access, we've mitigated its cumulative effect. It's not having a long-term affective consequence in those animals. And then the last piece of data I wanted to show you relates to a new study. This is not published data yet, but it will be shortly. And this is a question about male mice and whether male mice prefer to live on their own. And actually, the data is all pointing towards the conclusion that, yes, sexually mature male mice prefer to live on their own, and they don't really like IVCs. And the way we know that is we look at this development of what we call a reward-induced bias. So this is what happens in people with mood disorders. They're impaired in the ability to take reward value and use that to learn and to drive future behaviours. And when we take that, we turn it into an assay for mice. This is a simple learning assay. So what we're saying to the mice is you've got two options you've got to learn about. It's quite complicated, actually. So they've got to learn which cue predicts reward, and that one of the cues predicts a high value reward and the other cue predicts a low value reward. And what we know from doing control experiments is that animals in a more positive affective state will start to pull apart. So they get the value of the higher value and they use that to influence their behavior, and they learn quicker. And it's a great assay because humans do it, rats do it, and now we've got the data for mice. And what you can see is this is single house male mice, and they develop a nice reward-induced bias, suggesting that they are in a normal affective state. Whereas the guys that were group housed, now they were 3 per cage, And we were intentionally using that number because we know that's pretty much associated with some of the worst kind of conflict, but 3 per cage, and we do not see any pulling apart. There's no reward bias. And interestingly, we can replicate the finding in conventional single-house male mice. So here, this is a replication of this study. But when we have those mice singly housed in IVCs, they're not so positive. So what we don't know yet is why that is. Is it because it's sensory deprivation? Is it because it's cold? Is it because there's lots of possible factors? And, we'll hopefully get to explore that a bit more. But just to really highlight that this is equivalent to chronic exposure to corticosteroid, which is a depression model, which on my current Home Office license is a moderate protocol. And so this group housing of male mice, in terms of the affective experience, they don't show clinical signs, but effective experience is equivalent to a depression model. And I'm going to hand over to Megan for the next bit.
Oh, hi everyone. I'm Megan. I'm the mouse person in the team, official title. And I'm going to talk through some of the refined methods that we use in our management of mice. So really there's kind of 3 core things we need to think about when we're thinking about what's best for mouse management. So thinking, what are the best housing conditions for mice? How can we minimize stress associated with handling? And how can we minimize stress associated with restraint? Because these are inevitable things that we do as just part of our day-to-day jobs in the lab. So kind of thinking about our sort of current approach to housing, I think the sort of guidance at the moment is that mice are thought of as a social animal, and therefore that we should be doing everything we can to make sure that we group house our mice, and that's what's best for their welfare. But I think anyone who's kept mice has probably dealt with the fact that when you're group housing mice, you get a lot of fighting. Some fighting can actually escalate to severe levels or even death. And that's something that we kind of just take as part of the course. But I think going against the grain here, we think that maybe mice might prefer to be single housed. And I think getting this right is really important because this has a profound impact on study outcomes. It affects their affective state, which means, of course, we're not looking at a normal mouse. But also we might end up losing N numbers, which means we need greater N numbers to achieve our experimental outcomes. So we might, in a way, be sort of wasting animals. So there's sort of 2 different ways of approaching this problem. We can either give them more enrichment if we think it's an issue to do with sort of, resource guarding or something, or we can think about what happens if we actually single house them. And we've actually approached this question in both of these ways. So one of the things we looked at is whether enrichment helps. So if we add enrichment, does that reduce the level of fighting? So we gave the mice something that we call premium enrichment and compared that to our standard enrichment and no enrichment. And premium enrichment was essentially lots more tubes, some sealing tubes and some housing that allowed for them to have their own sort of separate compartments. And we expected that if we gave them more enrichment, we'd actually see less fighting. But we ended up actually seeing almost the complete opposite. We were looking at whether there was sort of severe injury related to fighting. And we found that in the premium enrichment group, there was actually a higher degree of fighting that led to severe injury. So it almost seemed to have a sort of counterproductive effect. So then we thought about, okay, how does affective state change if we single house our mice? Is it as bad as people are telling us where we should be avoiding single housing at all costs? So we used the objective measure that Emma just described, this sort of reward learning assay. And we found that single housed mice in conventional housing had the greatest percentage reward bias, which means they're better at learning the higher value reward, which means they're in a more positive affective state. So it seems like single housing is actually what's best for their affective state. And that's in conventional housing versus IVC as well. So from this, what have we actually learned? Well, we learned that adding extra enrichment to a group house cage doesn't necessarily solve the issues with fighting and could actually even exacerbate it. And single housing mice in conventional caging may be optimal for the emotional state of the mouse. And this, of course, has really, really significant implications for welfare and assessment of normal behaviour, and really just the way that we do things, kind of going against the general guidance of having to group house mice. This is something that we should be changing. And that's something that we've implemented in the lab ourselves. So this is our standard housing approach for male mice now. So they're housed on their own, but we make sure that they have a good level of enrichment. So we provide them with a shelter, plenty of nesting material, because we know mice have a really strong drive to nest. We provide a hanging tube in the cage because they spend a lot of their time on the ceiling. They like to climb, and this also increases the available space. And we also provide a couple of tubes as well. And this has worked really well. And it kind of gives them the opportunity to exert some of their more naturalistic behaviours in terms of exploring, climbing, and nesting. But of course, we are working with almost a shoebox style cage here, and we can't provide them with everything that they need and things that kind of keep them interested, because of course over time these things probably become a lot less novel. So we also give them access to a playpen. And this is particularly important when the mice are off study, so they're just waiting for a study to begin, or they're having a break from studies. We put them in the playpen so that they can kind of experience a lot more sort of interesting different types of enrichment, from like ropes to bits of different types of nesting material to lots of different platforms, things for them to climb on. And they seem to really enjoy it. And it's also a sensory experience for them as well. So not only do they have the scent of other mice that have been in there, but we also provide different scents for them as well to explore, because of course mice and rats as well are olfactory creatures. So that's another domain with which to provide them with some enrichment. So I've got a little video here of them in the playpen. But you can really tell how much they enjoy sort of interacting with it, and they don't seem to get bored of it as well. And they don't even need that long. Even just 10 minutes is enough to kind of give them that sort of, I guess, change of environment, which is really important for their welfare. But you can tell they like to kind of go into all the different tubes, and they enjoy the kind of different heights that you can provide, and exploring all the different types of material. So moving on to mouse handling. So I think it's kind of been well established now that tail handling is bad, and there's been lots of work showing that that is not great, and that we should be moving towards tube and cupping methods instead. And that's definitely what we've been doing. But we also find that sometimes these methods need a bit of a habituation themselves, particularly in terms of cupping. You can't really sort of swoop in and expect a mouse to be happy being cupped on the first session. This is something that needs to be sort of done in a stepwise process. Otherwise, you might find yourself scooping up a mouse and it pings itself across the room or 2 feet in the air, which is stressful for the mouse and also for the handler as well. So we've established a sort of stepwise protocol, starting really from the very beginning of just guiding the mouse into the tube and then tipping them onto the palm and allowing them to run straight off, because some mice might not have even experienced a gloved hand before. So it's a big deal for them. So kind of introducing this to the process without asking them to do anything else is a really important first step. And here's a video just demonstrating how we would do that here. So it really only needs to be just a few seconds on the gloved palm. Some of them will stay for a bit, some of them will jump straight off. You know, every mouse is a little bit different, but that's a really important first step. And then after that, we do the same kind of thing again, but this time we gently move the mouse from palm to palm, again keeping our hands quite low in the cage because we know mice like to jump. And this again kind of just gets them used to moving between the palms. And it's actually more important that you let the mouse travel themselves from one palm to the other, so they actually feel like they're in control, because they like to think that they're in control. And this works really well as well, and letting them jump off the palm whenever they want to, so they don't feel like they're being restrained or taken away from their home environment. And then after this, we then move on to just kind of gently guiding them onto the palm. And by this point, they're actually pretty happy to just stay there. They know that the palm isn't a scary thing. We don't have to put our hand over the top of them. They're happy to just sit on the open palm. And that makes life really easy for when we're doing other procedures, such as scruffing or for dosing or taking samples and that kind of thing. So we kind of want them to be in a position where we can just happily just scoop them out, put them, for example, onto a vet bed, scoop them back and not have to worry about them flinging themselves across the room. So we're in control, but we're not actually controlling the animal. The animal is comfortable enough to do this by himself. And then finally, mouse restraint. So this is really common, of course, because there's lots of different things that we need to restrain a mouse for. So things like dosing, taking samples, that kind of thing. And while we can't sometimes avoid the actual need for restraint, there are things we can do to minimize the aversive impact of the restraint. But I think the first question you need to ask yourself is restraint actually necessary, or is this just a handling problem? And even procedure-wise, like, do I need to give this drug by a method that requires restraint, or can I give it, for example, orally instead, via a palatable solution? Of course, this depends on like the experiment you're doing, the pharmacokinetics of the drug, etc. But you should always be asking yourself, is there another way before going with a way that requires some kind of restraint? And habituating with cup handling is really, really useful for this. Just having the animal comfortable with being in your hand makes it much easier to actually scruff them, because they don't associate any hand time with something that's aversive. So it's actually more of a positive experience for them. So this makes it really easy to actually go into a scruff. And finally, there are ways that we can scruff the mice without using the tail. So I think the sort of more common one is to take them by the tail and put them onto the cage lid and do it that way. But we've actually developed techniques which means we don't have to touch the tail at all. And we can do that by either putting them on our arm and scruffing them that way, or by putting them onto the vet bed and scruffing them like that. And we have a video here just demonstrating this. But you still get a very effective scruff, the same level of scruff you'd get from the tail handling method, but without having to actually touch the mouse's tail. And of course, this mouse is well habituated to cup handling, so he's happy just being handled that way. And you get a scruff, again, without having to touch the tail. So to conclude, contrary to widely held beliefs, single housing of male mice may be optimal practice for their welfare. And I think that's something that we really do need to think about because, of course, the current guidance at the moment is that we should group house our male mice. Mice can be easily handled on the palm, but this does require a stepwise approach to minimize initial stress, both for the experimenter and for the mouse. And sometimes restraint is unavoidable, but we can reduce its impact by making refinements in how we actually go about restraining the mouse, using methods that don't involve touching the tail. So that's it from me, and I'm now going to hand over to Julia, who is a specialist technician in the team.
Thank you. So I'm going to talk about ways that we can practically implement the 3 H's in our management of rats. So this is the standard housing that we use for our rats. As Emma touched on previously, there are limitations. You have to balance the scientific and husbandry needs with allowing them to express their natural behaviors. There might also be study-related requirements that might affect the amount of enrichment that you can put into the cage. And the more enrichment that you put in the cage, the harder it is to assess the animals from a welfare standpoint. So we think playpens are a really great compromise in providing that extra space, that extra variety of enrichment that the animals can interact with for a limited period and then be returned to their home cage. I've gone backwards. There we go. So this is a video of some rats in a playpen. And the things that we add into the playpen, we're trying to provide them with different olfactory items, different tactile items. They seem to quite enjoy sort of uneven surfaces to run across. And our rats will go into the playpens for between sort of 10 and 20 minutes at a time. They can go in groups. Rats are very sociable animals. So they enjoy the social interaction. They really like pine cones because that provides both the olfactory and the tactile stimulus for them. And we can use the playpens as part of the habituation and also as a reward to reduce the impact of aversive procedures like Emma showed in the talk previously. So this is just an example of our habituation protocol, and it's available on our website. So you can download all of our protocols from the website. The key things to note are the first impression that the animal has of you is probably the most important, because if you start with a positive impression, you're building on positive experiences. If you're starting with a negative impression, you're fighting against that negative association that animal has with you for all of the subsequent interactions that you have with them. So what we try to do, and in this first video, you'll see, we try to keep the first interaction really short. So it's literally just picking the animal up, putting it back down, and then providing reward in the cage. So it's a brief experience, and their takeaway from the experience is positive. And it also shows that it doesn't take an awful lot of time out of your day. And then as part of the habituation protocol, you can introduce them to any equipment that they're going to encounter as part of the experiment. You can introduce them to vet bed if you want to use vet bed. for dosing or for getting them to sort of sit still for sampling procedures. And you can introduce them to dosing positions as well, get them used to that, and always providing positive rewards so that all of these experiences for them are positive. So then when you actually have to come to doing the procedure that they might find aversive, you're building on all of the positive experiences, so it minimizes the stress associated. And if you follow a habituation protocol like this, you should end up with nice, happy rats that are excited to see you because they're expecting good things and they're almost fighting with each other to get picked up. There we go. Because they're happy to see us, which is nicer for us as well. It's nice to walk into a unit and have your animals happy to see you rather than hiding from you at the back of the cage. There we go. So there are going to be situations where we do need to handle our animals for procedures. This is an example of oral administration. So the traditional method for oral administration is gavage. So it involves really quite firm physical restraint. There's a risk of adverse events, so tracheal dosing, esophageal trauma, bite and scratch injuries to the person doing it, and it requires a high level of technical skill. So what if instead of doing it this way, we just ask the animals to drink from a syringe? So we put the drug into a palatable solution, we habituate them to drinking that palatable solution from the syringe, so that when we actually come to give them the drug, they've learned that when the syringe is there, there's something good happening. So they'll very enthusiastically come up and drink from the syringe. And what we're doing is we're turning what was previously a slightly dangerous and very stressful event, and we're actually turning it into something that they find rewarding. So reducing the stress and providing positive reward at the same time and dosing them. So it's a much nicer way to work with our animals. There are some things that you need to consider when you're doing oral dosing. So rats and especially mice, because they're foraging animals, you have to overcome neophobia. So the first time they encounter a food, they're not necessarily going to trust it. So with the mice especially, they'll eat a tiny bit of it, sort of go away, make sure that it wasn't poison. And then when they realize it wasn't poison and it was actually really tasty, on the second day, they'll come up and drink it enthusiastically. So what we do is we start about a week before we're actually going to start the study. And on day one, just put some of the strawberry milkshake or peanut butter or condensed milk, whatever we're going to use, put it into the cage so that they can interact with it in their own time, realize it's safe, realize it's tasty, and then gradually over the week, they'll approach the syringe and they'll start drinking really reliably from the syringe. The other thing that we have to consider is conditioned aversion. So if we're giving them a drug that makes them feel quite sick, then what we don't want to happen is for them to associate the palatable solution with feeling sick. So if the only time that they ever drank strawberry milkshake, they were ill afterwards, they're probably not going to drink strawberry milkshake again. So by having that habituation period beforehand, they've built up all these positive associations with strawberry milkshake and they never felt ill. So they trust it. And then on the occasion that they do get the drug in it, what we do is we give them a washout straight afterwards so that they don't have any aftertaste in their mouth. And then also later on in the day, we'll provide them with a second just vehicle, just the palatable solution. So they've got many, many positive experiences with the strawberry milkshake and only one negative. So they're less likely to think that the strawberry milkshake was the culprit. So it makes the oral dosing procedure more reliable that way. This is an example of subcutaneous injections in rats. So like I said, in the habituation protocol, this rat will have been habituated to sitting on vet bed. It will probably have been fake dosed. So we get just an empty syringe and just pretend to dose them with the empty syringe and then giving them rewards afterwards. So they're used to this. They're used to it being a positive experience. So when we actually go to dose them, you can see he's quite calm. He's not really being held at all. And then afterwards, he's fine. Yeah, still happy to interact. So that's an example of how having that habituation beforehand can really take the stress out of dosing. And then finally, IP injections in rats. So this Emma covered the study that was published on this that showed that it was significantly less aversive than using the traditional method. So you can see in the traditional method, the rats stretched out. It's held really firmly, which actually, if you think about any time that you've gotten an injection, what you're asked to do is relax, because injecting into a tense muscle is more painful than injecting into a relaxed muscle. So instead, we like to hold we hold the animal in a way that its stomach is actually really quite squishy and relaxed. And you can see he's been injected. He's not that fussed about it. And it's a lot less aversive than the traditional method. And again, this animal will have been habituated to being in that position, fake dosed with the syringe, given rewards afterwards. So it's not a stressful experience for it. So I'm just going to hand you back to Emma, who will summarize.
Thank you both very much. So hopefully that's given you a flavour of some of the different methodologies that we have been working on. And what we've put together is the 3H's website. So the website has downloadable guidance documents which break down all the different things we've been talking about into training sort of protocols. We've got videos so you can see the whole sort of different steps of the process and can implement that very easily within your own research. And we will continue to develop the website. So we're looking forward to getting feedback from people, but also as we learn more, we want to keep updating the website and bringing in it's designed to expand and have more sections added to it as these are the sort of the key ones that we have come across. So I will just sort of summarize my perspective on this. So implementing the 3H's is undoubtedly got a time cost. So it will increase the time you spend with animals, but I think it has a huge benefit for animal welfare, for the scientific outcomes, and also for human well-being. It's a lot nicer working with animals that are pleased to see you, that are easy to handle, that are not vocalizing. You don't feel, we very rarely get anyone bitten in the group. It's only usually a new student who hasn't paid attention to what we've warned them, that rats can't entirely be trusted. But it's so overall, I don't think it has lots of benefits. And as you implement these ideas and try them out, they'll obviously adapt to suit your own environment. But, we have things that are really efficient. So our rats and mice come in and they have a week's acclimatization anyway. And in that week's acclimatization, you can do handling habituation. You can actually also give them positive reinforcement, which can just happen to be the palatable solution you want to use for your oral dosing, because it does the job. And as you saw from the videos from Julia and from Megan, we're not talking about 5 minutes an animal or anything like that. In fact, that's not going to work. This is a very, very, very short. In fact, the shorter, the better. It's a human hand, positive reward. Human hand, a little bit more positive reward. It's a very quick process. For our own work, it has a big advantage because our rats are behavioural rats mostly, and they run for up to 12 months. And we can go into an animal room, we can pull cages out. We don't have to take lids off or anything. We just pull the cages out, open the lid, and 2 rats are ready, waiting, saying, "Excuse me, yes, take us out." And in fact, if anything, we have to kind of hold them back. Certainly in some of the tower cages that we use, we do have to hold them back. They will literally erupt out onto you. So it's really quick. And I can give you a really good example, having done some dosing a few months ago, where we were doing a chronic study and I was the last weekend of dosing. So I was dosing animals that didn't know me, that had been IP dosed once daily for 4 weeks. And I went in, I set the syringes up, and I dose from number 1 to number 16 in 15 minutes. And all I did, open the cage, they're there waiting. And all they're wanting is their sweet. That's actually all they're interested in. Get on and inject me. I want my sweet. So I think depending on the work you do, you may find actually that this ends up being more cost effective in terms of your time, because it is for us. If you're going to have animals long term, it's definitely worthwhile. I think, just as a sort of the key points I want to summarise to take away from this is cumulative suffering encompasses the lifetime experience of the animals. And it definitely needs to be thought of and extends beyond consideration of the procedures that we're using. And it's not just about that acute, obvious moment when a rat vocalises or a mouse shows, hunched posture because it's feeling, it's having that short-term impact of the procedure. This is about their long-term well-being and how our environment, the environment we're keeping them in, is impacting on their kind of emotional, affective state, and how we can actually relatively easily do some small things that change that. There's lots of opportunities to refine the experience of animals of rodents through the inclusion of the sorts of methods that we're presenting as part of this 3Hs. We can enhance their housing environment. We can do that both within the cage with the right sort of enrichment, but bearing in mind that too much enrichment doesn't help. They can't have their cages so full they can't do normal behaviours if it's going to cause conflict. So it's a balance. But thinking about sensory enrichment, stop thinking about things as humans and think about them as rodents. The rodent world isn't visual, it isn't sterile and clean. It's full of olfactory cues, it's full of textural cues, it's all sorts of interesting things. Could mice be given different bedding substrates on a regular basis so that they get that enrichment even in their home cage? To reduce the stress associated with handling and restraint, if you can minimise restraint, we rarely restrain. In fact, we don't really restrain rats now at all. So our rats are very lucky. They get through with nothing, no restraint. We can hold them gently for IV injections, for tail bleeds, all of those things. Mice are a bit more challenging because mice are littler, and for their own safety and yours, it is a bit more difficult. But even things like now, if IP is the only time I would say we'd restrain in a sort of classic scruff. If you train mice to sit on vet bed, you can just take a little pinch of skin and subcut inject them. It's not the same as that real tight physical restraint. And they don't mind that. On the website, you'll see examples of those kind of methods. We can use habituation to refine mild procedures and things that are repeated. So that helps to, rather than those accumulating to end up at moderate severity, they don't need to if you're not using restraint. And in fact, if I'm giving a rat an antidepressant in an oral palatable solution, have I crossed the threshold of the Animals and Scientific Procedures Act? I don't know, because I have, obviously, and it's in my licence. But actually, if you look at it, pain, suffering and lasting harm, it doesn't. It crossed the threshold of equivalent of giving an injection with a needle, because the drugs don't have, they're used for a positive manipulation, and the animal's not involving any restraint or anything. It's choosing to drink the drug out of a syringe. And in fact, you do have to be slightly careful when you've got them all in a cage, because you have to dose them one at a time sometimes, otherwise they're squabbling over trying to get to it. Although we have some experts in the lab now who can do 2 rats at a time, one on either side of the cage, and have them trained to present, to be dosed, as it were. We can habituate them to procedures. And again, we do quite a lot of stuff where we're using head-mounted devices, we're wiring animals in, setting up IV self-administration, all of these kind of quite invasive procedures. And, in traditional days, this would have been a rat being wrapped in a towel in preparation for this. Absolutely no need to do that. We do targeted brain infusions. We are doing plugging in for amperometry recordings, electrophysiological connections. And it's all done just by training the animals to sit quietly whilst you teach them to have the head mounts set up and then plugged into things. And they will learn. And they do. If you don't make things stressful and let them think they run the place and they're happy, as long as they feel in control. So if they start to struggle, let them go and then start again. And you'd be amazed how quickly they kind of go, oh, right, if I just got to sit here then. Yeah, you just got to sit here. Oh, okay, I can do that. That's fine. But if you physically restrain them and try to force the issue, then they rebel. And the more I think we can use positive reinforcement to reduce the harms of negative experiences, the better we can. And I think, if nothing else, just simply think about when I approach these cages, when I'm doing cage changes, can my animal care staff, can they have a little box of crushed up sunflower seeds and scatter them into the cage so anytime the animals are seeing human beings, they get a positive association. And I think it will make a huge difference actually to how you interact with the animals and what you'll see in your units. But I look forward to hearing back from people if that's really the case. Certainly it is how ours work. And the methods that we have to objectively assess these welfare impacts, I think, provide the evidence we need to implement this as best practice. And the 3Rs does require us to use the most refined methods. So once we have the evidence base behind it, then we can kind of really push, I think, people towards using those approaches. And so I'm going to stop there at 3:00. Thank you very much to all of you online for joining. Please do get in touch with questions. I can see there's lots of questions already in the Q&A and in the chat. So we'll get back to you as soon as we can with those. And I hope you found it useful, and please do follow up. And I will draw it to a close. Thank you very much.